Yep, we can see the presentation. Looks great.
Okay, thank you. So my name is Cristina Tomoiaga, and we are joining from Cluj-Napoca, Transylvania, Romania. So we are joining the second time the symposium. We have been presenting last year as well. So it's going to be just me today, and I'm going to present our work through the year. So I'm part of the data lab, Digital Affective Technologies in Therapy and Assessment Lab, with Professor Oana David being the director of the data lab. And what we do here is that we develop and test digital and technology-based therapeutic assessment systems and interventions for children, adolescents, and now we've enlarged our population and go to young adults, so we can have all the youth population, and in the future we plan to go to the adults as well. Our interventions are aimed to promote emotional well-being and prevent emotional disorders. So last year I presented the REThink game. If those who joined last year remember, it was a mobile game developed for a therapeutic mobile game developed for training emotion regulation abilities in children and adolescents, and we presented the assessment system, the validation of the assessment system as a evaluation instrument for emotional regulation abilities. After we evaluated and validated the assessment system, what we did is we launched an adaptive sequential multiple assignment randomized trial, or short, a SMART trial, where we recruited 186 children and adolescents aged 8 to 16 years old, and we randomized them into the REThink game and a mobile mood monitoring app called Mood Wheel that they have to test for and to play for 4 weeks. Then we assess if the game was effective or not for those, and who responded to the treatment. They just gone to and received for another few weeks the mood monitoring app, and if they didn't respond to the game and the game didn't help them enough, we offered them another intervention, a mobile intervention called side pills, for of course another 4 weeks. And then of course we assess all the effects of the interventions. We measured emotion regulation abilities, emotion, compassion, beliefs, and so on. And actually, this is the first time we present this study because we are collecting the follow-ups. We have a 6-month follow-up to see the effects on the long term. And we are still collecting data, so we have just very few preliminary results. So here are the interventions. If you joined the symposium last year, you remember the REThink game with the 7 levels developed specifically for children and adolescents. And we have the psychological PsyPills app, which has a child version and an adult version. And of course, the Mood Wheel app, which I will talk about later again, which is a mood monitoring app, of course, again, with child version and adult version. So what we did is we test the intervention, and also besides the emotion regulation abilities that we tested, we also tested the usability of the game to see if the children and the adolescents we enrolled in our study actually like the game, they find it interesting, and so on. Here we have the preliminary analysis and results from the SMART trial we conducted. As I said, we are in the process of data collecting and analyzing, but so far we analyzed the first part of the trial, namely the effect of the REThink game compared to a control group. And we observe and obtain significant differences between the experimental group and the control group for the sadness subscale of profile of emotional distress, meaning that the REThink game managed to reduce negative emotion of children and adolescents enrolled when compared to the control group who didn't play the game. And we received significant results for increased compassion towards others, specifically for the children who played the game. The way we did it is we tested in schools the game. We went to schools and we had some devices that they need to play the game with, and then there in the school we assess as well the game effect. So as I said, we tested the usability of the game, and we saw that smaller children are interested of the game, but older children and adolescents, let's say from 12 to 16, which we had data for, they found a little bit childish. So what we did based on a research project funded nationally is we developed another updated version, let's say, of the game for children, for adolescents and students. The grant was received for student population. So what we did is we tested on the students population with the aim to test the new version of the game on adolescents as well. And of course, in the future, extend it to adults if possible. In the new project called REThink Academy, what we did is we tried to develop an ecological momentary assessment tool, and we used the Moodle lab that I previously talked about to have multiple factors in the same app to have students complete the app. We said daily, but they didn't actually complete it daily throughout the semester, but they completed the app throughout the semester several times a week. So we had the aim to identify specific combination of factors and moments in time, stressors, relationship problems, problems with adaptation, school, and so on, in order to find key points where we need to intervene and have and deliver intervention in order to prevent them for developing later on serious emotional problems. So what we did with Moodle app, we included several instruments, psychological instruments inside the app to evaluate different aspects of our students: their mood, their beliefs, their behaviors, their social interactions. We also, that were self-reported. We also had included a heart rate measure using the camera from the phones. And we also connected it to a smart band to evaluate the heart rate variability of the students, and also include some behavioral parameters such as step count, sleep, and their activity on the phone. Means what apps did they use mostly during 1 week. And we try to combine all this data to analyze, and we will develop and analyze the data we have from the whole year in order to assess which specific moments are the most important, that we have to look at them and intervene there and deliver interventions in order to help them when they must need the intervention. This app also has child version and adult version in order to encompass all the population we are interested in. And back to the game. So last year I presented the REThink game, and this one, based on our results, we developed the REThink Life game. This new version of the game is based the same on the therapeutic theory, and can be accessed by desktop or using VR, because it has two forms: the desktop form and the VR form. And this one is developed to be most suited for adolescents and students and younger adults, because it's developed as a journey to train important abilities for succeeding in life. It has just 4 levels compared to the 7 levels we have for the mobile app developed especially for children. Each level having 3 sub-levels and training a specific emotion regulation ability. We also have an assessment system included and some personalization features. Here, the game is developed around the character of Redman, who practices the secrets of bright mind, where you learn healthy emotions, healthy way of thinking, and healthy behaviors. And the mission of the player is to help Redman save the earth and the minds of the inhabitants from the powers of the evil character called Irrationalizer, who has some servants which who infect people's minds with dysfunctional emotions, dysfunctional thoughts, and bad behaviors. So these are the 2 characters, and the players need to help the good one fight the bad one. And here we have another character involved now, named Optimizer. I don't have a picture with it because the game is so new that we didn't finish all the refining on it, who provides guidance for players. Guidance at the beginning and the end of each level, where she is a female character, where she asks participants and players to think about their values, their strengths, to set some goals in order to have this game as a journey of personal development for children, adolescents, and students. Yeah, we tested the game for students, but we are planning to test on children as well, but let's say not 8-year-old children, in order to understand the more complex concepts from the game. So here we have level 1. As you can see from the pictures and a picture with myself as well, we have used real characters in order to show emotions, to have a more ecological training of how emotions look on the faces, and using body language as well with the facial expression. And the first sub-level has 3 first level has 3 sub-levels. In the first one, they need to distinguish between an emotion and a neutral state. In the second one, they have to discriminate between emotions, and they have 4 choices. And in the third one, they learn the difference between healthy and unhealthy emotions. They are presented with 20 characters for each sub-level, and they have to choose the correct emotion. We have children as well as a character, we have adults, and we have younger adults, let's say adolescents as well. The second level is the best to be played, especially in virtual reality format with the headset and so on. And because it trains the relaxation and mindfulness abilities. So in the first and the second sub-level of this level, players are taught a very simple relaxation exercise based on breathing. Here they have to learn to relax while their attention is solely on the breathing. And to better train them, we use the pictures with the dandelion that you see on the screen. They in the first picture, they have to smell the dandelion, then to hold their breath, and then to blow the flower, which is the white one in the second picture. So here they have to do this for 5 minutes in order to practice the relaxation breathing technique. In the second level, they have to do it while ignoring other elements on the environment, and it's aimed to help them practice the exercise and to be able to use it in their real life, where they have when they need it, and where they have a lot of elements around them when they try to relax and if they are stressed. And in the last one, they are presented with the last image that you see down there. It's a beautiful scenery, and they have to pay attention to the elements on the screen and count the butterflies. This specific level trains the ability to be mindful of what's happening and be here focused on the present. The third sublevel, it's based on the distinction of the healthy and unhealthy beliefs. And they first have to go through the assessment system where they assess their frustration tolerance. As you can see in the first picture, the evil, let's say, character, the rationalizer is presenting, as well as the red man, and the player's mission is to tap on the good characters, which are presented down here, in order to extend the power of the red man and not the irrationalizer. The game here in this sublevel gets harder and harder till the point that it's impossible to make, in order for us to assess how much time they spend in this specific sublevel, and we measure their frustration tolerance. Then in the full game training, then we train them and we provide them with information about rational and irrational beliefs. In the first sublevel, you can see in the second picture, with the help of the characters, down are the positive characters, and up there is the negative character that needs to be neutralized. And in the last two sublevels, in order to make it the game as well more ecological, we presented them samples of how this irrational belief really sounds. And it's in Romania here, but it says, I don't like to lose, I want to always win. And they're presented with specific samples of how an ecological belief sounds, in order for them to train their mind to recognize irrational beliefs and to know how to neutralize it. And the last sublevel is a positive bias task. They're presented in the front of the classroom, and they have to recognize the happy face as quickly as possible. In the first sublevel, they have to distinguish the smiling faces between ones with emotion of disgust, in the second one against emotion of anger, and in the third one they are combined. So here his task and the player's task is to identify as quickly as possible the smiling faces, in order to train their ability to focus more on the positive side rather than in the negative side. And here the assessment is composed of the first sublevel, where they train their ability to distinguish between disgust and choose as fast as possible the happy face. So we developed this new game, the REThink Life game, more like a journey towards emotional development and improving emotional well-being. For now, it's available with English storyline, and we have Romanian subtitles, but in the future we will include multiple languages, at least English and 2 or 3 more internationally used languages. And we tested and we validated the assessment system for this version of the game as well, for 160 first-year students who played the REThink game in the exam session. They completed a series of instruments for mental health, for stress intolerance, emotion regulation abilities, mindfulness, rational or irrational beliefs, and emotional awareness. And I want to show you some of our evidence and preliminary analysis. Again, this year we've been busy with developing apps and interventions and the game, and we collected a lot of data, but we didn't have the chance to very clear look at it. And we found that the first sub-level correlates with anxiety, mindfulness, and some other sub-skills from the emotion regulation scale, which means that higher abilities of emotion recognition correlates with lower anxiety in the case of anxiety, higher mindfulness, higher acceptance, and so on. For level 2, we have a correlation with depression, rumination, and positive refocus subscales, which means that players with higher mindfulness abilities tend to have correlate with depression, less rumination, and more positive refocus. For the third sub-level, we, as I said, we assess the time they spend in the specific level, and the time that they spend in that level before pushing the button, I give up, correlated with the achievement subscale, which means that the higher time they spend in the level means that they have a desire to achieve, desire for achievements. And the last level correlated with rational beliefs and negatively correlated with stress, anxiety, and depression subscales, meaning the more you focus, the player more focused and was on the positive smiling faces, correlates negatively, less anxiety, less stress, less depression. So starting from this assessment system and preliminary evidence, we now have the mobile version of the REThink game, which is validated for children and adolescents till 16 years old. And now we have the REThink live game starting from students. We need to fill in the gap between for adolescents in the future. And what we are going to do next is we also develop this student living lab, which means that we will have interventions in real life, in real campuses for students. And also we wanted to extend it in some schools in order for children to quickly access on our devices the intervention when they need it. So this is our work. Thank you for your attention. And if you have any questions or you want to test the intervention or collaborate on one of our intervention, the game, the mobile version or the new version, please let me know.
Cristina, that is some amazing work. I am so glad people like you exist, because that is not how my brain works. So you guys are doing some phenomenal stuff there. So thank you for presenting that.
Thank you.
Yeah, absolutely. If you may have mentioned this early on and I may have missed it, but what general patient population are you utilizing this with?
So we started our work with apps and games for children with emotional symptoms or children without any emotional symptoms in the present, but we are working for preventing them. We also are starting, actually this year, we are starting to use the game within hospitals, especially for chronic disease in children. And we also have a published paper on the use of the game with some collaborators from Germany on the chronic population. So as far as pediatric goes, we are trying to go in the hospital now, because we have tested it in the schools and now we are going to the clinical population.